Okay. So yeah, I was just saying it's going to really be an exciting session for us, and I'll be handing over to Dr. Joanne to take the floor. Over to you, Ma.
All right, thank you so much. Thank you very much for the great introduction. And I'm so glad to be here. So just like we know malaria right from when we're children, everybody feels malaria. I don't know many of us can remember the Sunday medicine for malaria that they were always giving to us when we're kids, just to be sure that you don't have malaria. But now we've all grown to know that you don't need the Sunday medicine, but that malaria is here with us, in Africa, a tropical country. Malaria is one of the leading causes of death in children. And if you look at hospital visits, if you go to any hospital and check, whether private or public, what takes most mothers to hospital, especially with their under 5 children, is malaria. And so it's like, are we overflogged malaria? No. Are we not discussing it enough? I don't think so. We are discussing it enough. But there's so much about malaria, and it's still leading to mortality among children. And I'm glad that Emzor has been able to put this together for us to talk about malaria with the moms and let people know what can we do, what are we not doing well, and what can we do well. And there are a lot of studies that have come up in malaria. If you go to the internet, thousands of studies every day, people are publishing something on malaria. So I think for us here today, we are going to be looking at it. How best can we help mothers to know, is this malaria or is something else, and what can I give to my baby if it is not severe malaria? So when we come to that point, we'll discuss, because malaria can either be complicated malaria or uncomplicated malaria. So what we'll be discussing more today will be the uncomplicated malaria. And your child comes, you just wake up. Like this morning, I saw a child in church, and the mother said, oh, my baby was very fine, but 3 days ago, she developed fever, high-grade fever. So for us in pediatrics, children from 3 months to 5 years, what we also want to know is that, is the child convulsing? Did the child, just ask the mother, did the baby start to shake the body, and then maybe eye rolled up or something happened? You say, yeah, so that's convulsion. So that tells you that there is a febrile convulsion. Some other times you just notice that all your baby has is just that fever, refusing to badly, that they will not even want to accept anything. Or at other times, some of them may may have low blood sugar, which is known as hypoglycemia. So that's a complication of malaria. Or at times you notice their urine becoming so dark colored urine, or their eyes may even be yellow like jaundice. So all those are now like symptoms and signs of severe malaria. Or from that convulsion, the child had repeated convulsion, what can happen? That child can now go into what we call like coma. Is not corresponding again. But if it's malaria causing it, then that will be like a form of cerebral malaria. So there are so many types of malaria and complications of that can occur in children. And what I want to point out here very importantly is that not every fever in your baby is caused by malaria, especially in the under 5s. There are so many things that can cause fever. Because you just see some mother, my baby is hot, it's malaria. It may not be malaria, it may be something else. Sometimes too, as mothers, we know we like washing a lot in the kitchen. Our hands are always very cold and everything. And because you're a very caring mother, next thing you just go, you're touching your baby's forehead, touching everywhere. Next thing you say, my baby is hot too. But forget that your own hands are very cold and you're going to your baby. So what are you going to be feeling? It's going to be like a transmission. You're feeling that your baby is hot. So what I always advise mothers is have a thermometer in the house. When you have a thermometer, every mother that I meet, newborn baby mothers, I said, do you have a thermometer? They said, no. I said, okay, go to the pharmacy, buy one. If they don't show you how to use it in the pharmacy, bring it. We are going to teach you how to read off to know whether your baby has a fever or not. And then if that baby now has a fever, we start asking questions. So you don't self-medicate and just go and buy over-the-counter anti-malaria and start giving. No. Importantly, you must go and run a test for your baby. And it's so good now that we have what we call the rapid test kit for malaria. So you can just go there while you are there, even in the pharmacy shop or in the lab, they run the test and you get the results immediately to know whether your baby has malaria or not. If the baby now has malaria, then that baby is going to be treated for the malaria. So I think maybe I'll take a break here and then allow you to ask more questions. except you want me to continue.
Yeah,
Okay,
thanks
ma.
a lot, Ma. Maybe before you go ahead, I think that there's a question that the mom has already asked. She had asked if a baby of 11 months can take malaria drug.
Oh, very good question. There's what we call congenital malaria, neonatal malaria. So a baby can even be born and have malaria. But when we first see fever in the newborn, as pediatricians, we don't think about malaria first. Why am I saying so? Because fever in the newborn cannot be localized. Infection in the newborn rather cannot be localized. That infection can be septicemia, sepsis, and that sepsis, because they cannot localize infection, if you don't treat it as sepsis where the baby is given intravenous antibiotics, it can end up with meningitis. So I want to clear that air first, that if a newborn baby has fever, please don't treat at home and say it's malaria. Let that baby be taken to the hospital, because if it is sepsis and is not treated, then it can move on to what, meningitis, and then that baby can have complications of meningitis, can now develop cerebral palsy. So many things can come in because that brain is already damaged at that tender age. So an 11-month-old baby can actually have malaria, and we've seen a lot, even from 6 months of age, when the immunity has started waning off, most of them can come down with malaria. But we must test to be sure that it is malaria before we treat. Thank you.
Yes, thank you so much, Ma. I think that's so. In response to the question, yes, an 11-month-old can have malaria, but we would also
Yes.
need to take the child to the hospital first to ensure that it's tested first. The child is tested first before we begin to introduce medications to the child. You had also mentioned something about convulsions when you spoke earlier. You mentioned that you'd ask questions, is the child shaking? And then we'll bring the child to the hospital. So maybe just to make that clear for moms on the call, what's really at the high risk for these convulsions, and when do we need to treat it as an emergency? What can we even do during the process of rushing that child to the hospital? Is there something we can do at home first while we are on our way to the hospital or something, especially when we notice that the child has the high fever, like you mentioned?
Yes, very important question. So the first thing is that whoever you are, the first thing you're going to do when you see your child convulse, even for us in the medical profession, there will be that little panic for the person in the medical community. You'll panic, then not to talk of a mom that is not in the medical community. So that panic will be there. But what we advise the mothers, do not panic. And then number two, do not try to force a spoon. Some mothers will now carry spoon. I don't want the teeth to gum together. They put a spoon. Or they say some people will now come, those your grandmas around the community. Oh, let's put some palm oil inside the mouth. And then in the process, if you are trying to force something inside someone that is convulsing, remember the coordination to swallow, to take what you are bringing and to swallow is not there at that point. What can happen? That thing can go to the airway, and the child can aspirate and cause more problems. So don't do anything at that point. Just put your child, to lie on the left lateral side, so that if there is anything coming, it will go out. You understand? And then move your baby to the nearest health facility. And if you get to the health facility, then we'll be able to stop the convulsion with medications that are available. Either if we cannot quickly get a line to stop put the drug to stop the convulsion, we can give it through the rectum, and then that convulsion will stop. So the advice for mothers is, don't try to put anything at that stage. But one thing that is key here is that if your baby has a fever, very high grade fever, the tendency to convulse is very high. Especially that fever that just starts and immediately is already in the sky. Using sky now, that's maybe going up to 39.5, 40 degrees Celsius. That kind of baby can convulse. So what we'll advise the mother at that stage, just use tepid warm water in the house, and then tepid sponge your baby, lukewarm water, tepid sponge your baby, and then give that baby paracetamol. So you can use the dispersible paracetamol that Emzor has made available now in the market. You give that baby that paracetamol, and then please move your baby to the next available health center that is closest to you. Then secondly, at this point, if a child has convulsed once, sometimes the the risk of that baby convulsing is higher than a child that has not convulsed before. That doesn't mean that the one that has not convulsed before will not convulse. But if your baby has convulsed before, please, that baby with fever may convulse again. So you have to really watch out and ensure that when you notice that fever, please give paracetamol to your baby at the prescribed dose, within the safe dose, and then you can now move to the hospital. Thank you.
All right,
Okay,
thank you
thank
so
you
much,
very
ma.
much, ma.
Yeah,
Thank
Demi,
you,
go
ma.
ahead. Let's add
Thank you.
something.
Yes, so there is another question here from one of the viewers, still on the malaria treatment. Says, so I've noticed these days that after taking oral malaria medication, you still need to take the injections because there is still malaria after a second test. Is that okay?
Okay, so I think if we look at the guideline that is available, injections are just supposed to be mainly for severe forms of malaria. It's supposed to be for severe forms of malaria. But we have a lot of practices that people do that is not really the proper practice to be done. So if you've taken one type of oral medication and you test and there's still malaria, you're supposed to actually take another type of oral medication, except you are now having a severe form of malaria. So I think on this call, we should be able to, we're trying to let people know the proper thing to do. So let's leave the injections for severe forms of malaria. And I already mentioned those type of things that, that constitute a severe form of malaria. If you take your child to hospital and say, your baby convulsed, and from that convulsion, he had another convulsion, complex febrile convulsion, that baby would deserve what? Injectable. Baby has malaria, injectable. Or baby's blood level became very low because the malaria parasites have, been there for some time, and then baby has now developed severe anemia. That baby will also need injectable. If the baby has jaundice, like I mentioned before, and that jaundice is because of malaria, the baby will need injectable. But if it's just that the baby's body is just hot, and then you give the first anti-malaria oral, it did not work, you do a test, the malaria parasites are still there, and they are not as high as what we will say is a severe form of malaria, please, we'll give another type of oral anti-malaria. Thank you.
All right, thank you so much, ma. I think that I've actually picked something from what you just said. Because let me just use my daughter as an example. We've had this recurring malaria back to back the past few months. And usually what happens is when we go to the hospital, we do a test. It comes out with maybe 1+. She's placed on anti-malarial oral drugs. So assuming the anti-malarial, the oral doesn't work, we go back again to the hospital and then we are just moved to an injectable instead of trying another oral. So what I'm picking from you here today is that if it's not a severe malaria case, like has the convulsion, anemia, and all of that, the best choice would be to switch to another type of
Yes.
an oral medication instead of just switching to injectables. Because after you even do the injectables for 3 days, you'll still be placed back on oral again for another 3 days. So you'll see that a child has been taking anti-malarial for almost 9 days, and a child of
Yes.
like 8 to 9 months, which I mean, it can be very stressful. Yeah.
Yes. And then maybe just to take it from there, someone just wrote here, yes, it is always not as high as the first test. So you realize that the parasites are not whatever they found there. Maybe we don't use those words anymore. But if they saw, if you look at the lab result, they'll tell you it was 3+. So now it's 1+, or it's scanty ring forms. So it maybe may not really need an injectable. And then I would like to say that injectable should actually be used, that somebody like a pediatrician has taken that decision, or a medical officer, and says, okay, at this stage, I think we should do it. But if the medical officer still says, oh no, we want to give injection, now that can we try another oral form and see what happens? Since baby can take by mouth, if the baby can take by mouth, let's use the mouth and reserve the injection for when we really need to use them. Thank you.
Yes, thank you so much, ma'am. Maybe one other thing I'd like to call out on the call, particularly for the moms, is let's also know the reason why we pass across a lot of all this information is for us to be able to use it to advocate for our children and for ourselves as well. So if you're in a situation where you're in a hospital, we join a lot of calls, we have a lot of sessions, you learn a lot. You should be able to ask the doctor why I also need to suggest XYZ because it's your child as well. I mean, doctors also know the best, but if you are also have the liberty to say, okay, I think this would also be better, or why don't we try this as well? I mean, it's a both of you should make the decision together essentially, and also make
Yeah.
sure that you get all the information you need, you ask all the questions that you want, and you advocate for your child as much as possible. I always try to also point that out. So I mean, this is why we're also learning on this call as well. So yeah, thank you so much, Dr. John. Just to add
Thank
that.
you.
Thank you, Dr. Joan. So still on the oral anti-malarials, recently there was a notice out there that NAFDAC put a ban on the ACT suspensions. Can you shed more light on why and why moms should pay attention to this at this time?
Okay.
And
Thank you
the
very. Yeah, so just like I said when we started, malaria is something that is here with us because of the humidity in our environment, the tropical area of where Nigeria is located. And so lots of studies are being done to see how best can we curb malaria, even up to the point that there are vaccines now for malaria, but that's a talk for another day. So what NAFDAC has done now is that they've looked at it that the suspension, personally, I never really like suspension anti-malaria, so I confess it here. And why do I say so? Because most times the dosing that is there on the packet, mothers just go and buy that dose, that medication, and then use that dosing, and it was never effective. It's like under treatment. So you now see a mother coming to you, the child is now having severe malaria. So I bought the suspension, I gave it at home, I gave this, and it did not work. So now NAFDAC has come to see that because of the storage of this suspension and then the underdosing, that it is not effective for managing malaria in children. And that is why they brought out advice companies to rather prepare the dispersible medications or the tablets that are not dispersible. So these ones, the doses are like fixed, and then one can be sure. Because if it's suspension, tell a mother, give 5 meals. And now we have a lot of working class mothers, and she's like rushing to work, and she'll tell the help in the house, I beg, when is 3 p.m. or 1 p.m., give a baby 5 meals. That girl that is from the village that does not even know, the woman would have shown her where 5 meals is. She will now go and do 2.5 meals. When you come back from work, did you give baby medication? The answer is going to be yes, she gave. And she's not lying. And sometimes because you're now like trying to now say, how can I fix dinner or lunch? You forget to ask, okay, show me the point at which you gave. So all that has made it not to be very effective. But if it's the dispersible tablets, you just tell her, okay, this is what you are going to do. Put this tablet inside the small water like they're going to show us in the demo later, and give to baby. That's one you are sure that is going to be done. So with all this, I think that is why NAFDAC came up with suspensions not being so effective in managing malaria in children. Thank you.
Thank you very much, Ma. So are disposable tablets safe for children of all ages?
Yes, disposable tablets are safe for children of all ages. They are safe for
Okay.
children of all. Yes. Just that I think I do maybe at this point to let the mothers know that we don't use artemether lumefantrine in children that weigh less than 5 kg. So if the baby is less than 5 kg or 3 months and below, we don't use artemether lumefantrine for them. We use other types of anti-malaria. So from 3 months of age, where the baby is 5 kg upward, we can use the dispersible artemether lumefantrine combination to treat the uncomplicated malaria.
Okay. Still on the dispersible tablets and the artemether lumefantrine, are there any mistakes that during the course of practice and interactions with mom that you see that they may make, and it's important they avoid in administering dispersible tablets to their children?
Okay, yes. So for the dispersible tablets, what we always advise mothers is use a little water to mix it. Maybe 1 teaspoon to 2 teaspoons. I'm sure the demo will show that. And then you get a clean container and ensure that the water is clean, because we don't also want it to be that you're giving your baby anti-malaria and then because the water or the container you used in giving it was not clean, baby will now develop diarrhea I don't know if we understand what I mean by that. Yes, because not now the anti-malaria being a problem, but the way it was given now becomes a problem. So you just drop it. That is called dispersible, in the sense that if you just drop it in that little water, what happens? It just melts off. You don't even need to start crushing it. No, you just allow it, it melts off into the water, then you stir it and give to your baby. Then the advice I would like to give at this point is that you can now put a little water again, just to rinse the little
Container.
container that you use, to be sure that there is no drug particle left, and give to the baby to drink. So that is what I think we should be encouraging mothers to do, not just giving the drug and running off. If you give the drug, if you remember, if you check it very, because I use dispersible also, if you look at it, you see that there'll still be little particles of the medications left. So very little water will help. And then the good thing is that about the dispersible drugs for children is that it has a nice taste. The taste is acceptable by children, so they're going to readily take it from you, and then you are sure that you are delivering the right dose. So that's why those dispersible drugs are now the way to go.
Yeah, thanks a lot, Ma. So maybe just to also call out, I know that a lot of the children, they don't like to drink any drug. As long as they know it's drug, they will not drink it. Whether it has a nice taste, they don't even want to know whether it has a nice taste, but they don't want to drink it. And I know some of the moms might already even be asking, is it something that we can just mix with juice or milk or something? I mean, let's just even be clear. Or do we just stick to just water for our dispersible tablets?
So, but if we're going to, since it's an anti-malaria, then for me, the ones that I have seen, at least like the one you also have, the taste is fine. So the babies take it, but if they don't, I always advise mothers, maybe just a little multivitamin or something that you can put inside. But I don't really advise that, because this is anti-malaria. But if it's like other tablets like zinc and all that, all those dispersible zinc tablets, you can do that. But for anti-malaria, we don't want anything that is going to have any adverse effect on the medication. And I always advise mothers also, know when best to give your babies anti-malaria. If they are going to take a lot of medications, you see some mothers, because you went to hospital, they give you like 3-4 drugs for the baby, you gather all and keep at the same time. No, let's not practice that as mothers, because even you an adult, sometimes you get tired of taking the drug. So that's, I always tell mothers, you can give 30 minutes in between. Maybe your baby is taking anti-malaria, taking antibiotic, give the anti-malaria first, whichever one you choose. Then you wait for like maybe 20-30 minutes, you bring the other medication and give. So if we practice that, I don't think we're going to have a lot of problems. So I'd rather we just stay with the little water for anti-malaria than bringing in any other thing to mix with it, except if it is in the manual of the company, because remember, we are dealing with formulations that companies have already looked at, and any additional thing to it may affect the efficacy of that drug. But if the company says that this medication, aside from water, you can also use maybe a little drink or whatever to add to it, then I think we can go for it. So for me at this point, my take would be, what is the final verdict from the company that manufactured that drug, so that we don't have any problem in terms of efficacy of the medication. Thank you.
Thank you very much, Ma. So we have a question here. It says, can boosting a child's immune system prevent malaria?
That's a good one. We won't say that it's going to 100% prevent malaria. What will rather, maybe when the immune system is optimum, what will happen is that that baby will be able to tolerate, will be able to have maybe not the severe form of malaria, because the immune system will also help the child to fight the infection. So, but the only way we can prevent malaria here is, number one, is ensuring that the bushes around the houses are cleared off. The gutters where the Anopheles mosquito would have been breeding, they are properly clean. And then you can use some residual indoor insecticide that you spray, and then you are sure that you've gotten rid of the mosquitoes that will cause the malaria. But optimally for everyone, when one has a good immune system, then the ability to be able to overcome an infection or an illness earlier and quicker is better than someone that has a compromised immune system. So mothers, let's learn to feed our babies well. And at this point, I would like to say all these fizzy drinks for children, let's take them away. We can actually make natural juices for our children at home. If you want to give your babies juice, make it, put it inside the refrigerator. It's cold, and your baby will still think that is the normal, the ones that are in the packet. If they like the packet one, put inside the cup and put a straw in it. They will still accept it and drink. So that will help the babies to boost their immunity. Thank you.
So
Yeah,
mothers,
thanks
pay
a lot.
attention to boosting your children's immune system.
Yeah.
Yes.
And
So I also want to ask, I know in most times, can a 1+ malaria also result in anemia in children, especially those below 2? So sometimes you see children with very low PCVs of about less than 30, and then they'll say, okay, it's the 1+ malaria that is contributing to that. Just want you to clear the air on that.
Yeah, that's a very good question. So when we look at anemia, anemia is not a diagnosis for us as clinicians. Something is causing the anemia, like you said now. Could it be malaria? Could be the other things. And for us in Nigeria, we have a lot of nutritional anemia. Most of the things, just like I said now, if a mom indulges in just giving the children high dense food that is not, maybe they buy lots of pastries and give to the children, then add it up with fizzy drink. The baby's stomach is already full, but is it nutritional enough? It is not. So we see a lot of people that have iron deficiencies from not taking in enough food, then coupled with malaria being also part of what is causing the anemia. So 1+, we're no longer using those pluses, but maybe for mothers, and most labs are still using it, so we'll stay with it. 1+ is not seen as severe malaria. It's not seen as severe malaria, but can it cause some level of anemia? Yes. But at 30, it's not enough to go and transfuse a child. If we treat the malaria and the malaria parasites have been eradicated at that particular point, so, taken care of, and then the child can actually go home, or maybe some things like iron supplements that will help to boost the blood level of that child. And then you go back and repeat the PCV and see what it is. But please, at 30, don't allow anybody give your child blood transfusion, because it's not severe anemia. There's a definition for severe anemia, which is 15% and below.
All right. Thank you so much, Ma. Dami, any additional questions? Any more questions from you?
yes, I can see a question here from a mom. Okay, so she wants to know what would happen when a child spits out a dosage, because children will not take any oral medication. So what would happen? What should she do in such a situation?
Very good. So what will happen is that if, as you are giving, the child brings it out, let's say vomits and all that, within 30 minutes to 1 hour of giving the drug, then we can repeat the drug. But let's say you give the medication and then the child is spewing out after 1 hour, don't bother yourself. The drug has already been, has already gone down. We're just using layman's language here now so that everybody will understand. The drug has already taken its course. But if it is within 30 minutes to 1 hour, we can repeat it again. Then if you repeat it, I would like to say it here. If you repeat a second time and the baby still spills it out, please the baby to the hospital. At that point, we may now need to give the child another type of anti-malaria, maybe probably the injectable. Because if the child has vomited the first time, vomited the second time, it may be moving towards severe malaria. So at that point, please go to the nearest health center, let them evaluate the child, and then take a decision that will be best for the baby at that point.
Thank you very much, Mark, for the answer. I'm sure that is clear. Do we have any
Thank you.
other question? Any other question?
So maybe while we are waiting for questions, one thing I also want to share with mothers here, especially for the artemether lumefantrine, when you give the dispenser, you know, we are also educating the moms here so that they can also take it out to the public space for us. That 8 hours after is very, very important, because at that's the time that you're going to have that drug at the maximum peak, and then to be able to take care of the malaria parasites that are in the body. So we don't do morning and evening for the first day, no. So if I give the tablet, let me say the baby, there is a 1-year-old child that weighs 10 kg. So at that point, we're going to need like 6 dispersible tablets. I'm sure from Dami and our dear farm, isn't it? Yes, that's the way your company has also made it. So we now give the first dose. Let's say you give the first dose at 10 a.m. So it means that the second dose on that first day is going to be at 4 p.m. Sorry, at 6 p.m., which is 8 hours after. But if you gave at 8 a.m., the second dose will be at what time? 4 p.m. So that first day is very, very important, because once to get that concentration of the drug to be optimum in the system, and it can take care of the parasites. And then the second day can now do morning and evening, the last day morning and evening. So I felt I should just bring that in so that it will be clear to mothers. But maybe the demo will also have that already.
Okay, ma, there's a question here that says, how frequently can malaria medication be administered?
So my answer here will be based on, one, what does the malaria test show? Remember, we said that not every fever or not every generalized body weakness is due to malaria. So if someone takes the malaria medication and still feels that, oh, I'm not feeling well, please have another test done. And the test shows that it's malaria, you get treated. The third time, don't just self-medicate again. Please go to the hospital and have a comprehensive health check done. And then also, not to look down on any particular thing, we also have to be mindful of where we are having the test done, because it depends on also who is looking at the slides. Except they're doing a rapid test. If it's not a rapid test, whoever is reading off from the slide, so we should be sure that it's being properly done. So those are the question, the answers I'll give for that particular question. So there's really nothing like saying frequently I must take malaria medicine every month. No. I know some people say, well, I have malaria every month, but please let it also be that you are running a test before you take the anti-malaria. Thank you.
Okay, ma. Thank you, ma. Anti-malarials are not immune boosters, so
Yeah.
get tested before treating malaria.
Yes.
Yeah.
So maybe just to also ask, how soon can reinfection also occur? Because I know someone has said 7 days before, that after a child has finished the course of anti-malaria, the child can get malaria again in about 7 days. Or maybe just to hear from you.
Yes, so if you look at the life cycle of the malaria parasite, is it possible that you did not completely clear the different stages? Malaria has different stages in their life cycle. So if the anti-malaria you took has not taken care of all the various stages, then the possibility is that within 7 days the person can get reinfected, or within 3 weeks can get reinfected. Most people is within 3 weeks to 1 month. That's why they say, oh, every month I have malaria, you know. But there are those that can actually get it within 7 days. And then it's not really that. Another thing there is that the medication the person use, you know, you are in the industry, so you also know that sometimes some of these medications, they can tell you that it is let's say for a adult is 80 milligram. Is it really 80 milligram? You understand? So it may be an underdosing, or the person did not take it properly. So with all that, you only suppress the parasites. So within 7 days, the person can have another infection again. But let's say the person had cleared the infection, it may take like another 3 weeks to 1 month for a new infection to come up.
Okay. Thank you very much, ma. Do we always need to repeat a test after treatment if the child is fine? Is that still necessary to be sure that the malaria is completely gone?
That's a very good question. You don't need to have to go and run a test again to see whether the malaria parasites have completely gone. If you've treated your baby is fine, he wasn't eating before, now he's eating well, your body is no longer hot, and child is playing around, I don't think it's necessary. And remember, like we talked about, these are children, and every time you're going to go and prick them, because let me go and check and see whether we have cleared the parasite in your system. For
It's
me, I
not
think
funny at all.
it's not funny, even for adults.
Even
So
for the mother, it's not funny.
for a mother, it's not funny. So I think we should just leave our babies if they are well. Then if they are sick, you can now go and do the test. Thank you.
All right. Thank you very much, Ma.
Yeah.
So, Naya, do you have any comments before we go to the demo session?
Yeah, so I think that it's been clear, and thank you so much, Ma, for making it so simple and direct. So I think a lot of what we need to know has been adequately captured. So that I think it would be good now that we see the demo of how we should mix these dispersible tablets, how we should administer, what to do, what not to do after constituting, and all of that, and any other additional medications that you think would go alongside this. Thank you so much.
All right.
Thank
So
you.
I have with me the Lockmal dispersible tablet. So I'm going to show us how to dissolve it. But the number of tablets and the quantity of water that should be used should be based on the doctor's prescription or the pharmacist's recommendation. Like Dr. Joanna said, don't do self-medication. Okay, so I have the Lockmal dispersible tablet here. It is Artemether lumenfantrine. It comes like this. So I have my measuring cup here. It's marked up to 10 mils. Then I have a clean spoon here to help me stir. So I would put 5 mils of water here. So like I said, the quantity of water that will be used and the number of tablets that should be given should be based on the doctor's prescription or the pharmacist's advice. So here's the water, here's the tablet. So you can leave it for a few minutes or just here to help the dissolution. And this is what we have. So after giving the child, like Dr. Joan had earlier said, you rinse the remaining particles with clean water and also give it to the child. So in treating malaria, you could also give the paracetamol dispersible tablets, which also comes in 125 milligrams. Or when your child has pain, rather than breaking one 500 milligram tablet into 4, you can just give one of this. It is also dispersible tablet. So just like I've shown us earlier, you can pop it in and drop it in water and give to the child. But like I said, the number of tablets and the quantity of water is based on your doctor's prescription and or your pharmacist's recommendation. Please do not do self-medication. So do we have any questions?
Thank you so much. What I would like to add here, maybe while waiting for if there will be any further question, is let's we advise mothers, please always ensure that at least you have paracetamol in the house. You know, maybe we're taking any other topic next time, I'll mention other medications, that mothers should always have in the house. But like we said, because of febrile convulsion, it can happen at night too, and you'll be so scared. So when your baby's body is hot, what do? Just give paracetamol, because we can't say if your child is the type that may convulse with fever. So always ensure that, at least, thank God for the dispersible paracetamol that is available now. You just take it, put it in a little water, quantity of water, and give your baby to drink, and then you move to the next health center. Thank you very much.
Okay. Still on the dispersible paracetamol. So with the dispersible paracetamol tablets, you can store for longer as long as you store in a cool environment. Please don't keep your medications by the window because doing so will degrade the medication, and it comes in 20 tablets. So Ma, I have a question here. It says, is migraine headache associated with severe malaria?
So migraine headaches are not, I won't say it's associated, but someone that has migraine headaches, when he now has malaria and then has headache, it may be worse. But there is no association between migraine headaches and malaria. But malaria can cause headache on its own. So if someone is already someone that has migraine headaches and then comes to have malaria, that there is also headache, is going to feel more headache than he would have felt if he did not have malaria. So at that point, there are medications for migraine headache. So that's not our topic. Malaria can also cause headaches that will worsen migraine headaches in someone that has migraine headaches.
Yeah, thank you so much, Ma. So one question I think it would be good to hear you from you on would be for our kids that are in school.
Yeah.
I know you mentioned that we should always have I mean, for us, moms that kids have not started school. Everywhere we go, we carry paracetamol in our bag and everything. But this can be different from kids that have already started school. And maybe just, I don't know, few tips on how best we can handle this with the school authorities.
Okay.
I'm thinking about it because I remember a mom had spoken to. She mentioned that her daughter was in school. I don't even know if she's on the call, and her daughter started convulsing in school, and the school did not know what to do. Then they tried to start putting a spoon in her mouth, and it was just a disaster. But eventually, thankfully, somebody called her and she rushed to the hospital. So sorry, she rushed to the school and then she had to take her daughter to the hospital. So I think that there's this gap between a lot of us moms. We have information, we learn, we
Yeah.
study, we do a lot of things, but we don't pass that information down to two people that are important: our nannies or caregivers that take care of our kids when we are not there, and also the school that we leave our kids in. Our kids spend, if you check, 80 to 90% of their days in school. So
Mm-hmm.
I think it would be good to advise us on how best it is to pass down all this knowledge to both our nannies and our school
Yeah.
caregivers as well.
That's a very important point you brought. So there's what is known as the school health program. By rights, every school is supposed to have a health post, maybe a little health clinic and something. Most schools in Nigeria, if you go and check, they have. But how trained are the people to know what to do? And like you said, it's time for us to, like this program we are having now with moms, it's time for us to begin to take what we know into the community. And you have a nanny at home. Does that nanny know what to do? Even our children, as they're growing up, are we teaching them, oh, if I'm not at home and you have a headache or you feel hot, this is the medication, this is how much you can take? Most times we don't do that. But if you go outside our climb here, many schools, as you're entering a school, you're going to see a certification in that school, that school has been certified, in terms of being able to manage common conditions that children may come up with while they are in the school compound. So it's very important that maybe for us that are healthcare professionals in the schools that our children are going to or close to us, can we pop in there and ask questions? Oh, what do you do if a child does this? What do you do if a child does this? If the child is hot, can you quickly give that child paracetamol? It should be there in your health bay. Paracetamol should be something every school should have in their health bay, and the nurse should be able to give it whether oral or parenteral. So it's a very important point, and I think we should see how we can take this information out into the various community space that is available to us. Thank you.
Yeah, thank you so much, Ma. So maybe just to reiterate, I mean, for the moms on the call, it's as I mean, even for moms that have not yet started school or their kids are already in school, part of the due diligence we need to do is How do you handle medical emergencies in your school? Let's see what you have. Let's see your health post or health clinic, how trained are the persons or your clinic staff and all of that. Let's also do that. And then as we also learn all of this, how to administer the medications, the dosage, how to store it, what to mix it with, let's also inform our nannies, caregivers at home, husbands, uncles, and other people that stay with us at home, how this should be given to our kids. There was also something very important you mentioned today about when a child vomits a drug that you're giving the first time within 30 minutes, you can readminister. If it's an hour, there's no need to. But if it's more than twice within 30 minutes, you should take the child to the hospital. So as we get all this information as well, it's not just for us, let's also pass it to family members that are living with us. And sometimes, because we are almost always not always, we're not always going to be there. And we need to ensure that our children are safe, whether we are there or we are not there. Yeah. Thank you so much.
Yeah,
Thank you
thank
so
you.
much. So before you, we have two more questions. Um, we'll go to our trivia. So the first one is it safe to take anti-malaria alongside with vitamin C? I know you've addressed that earlier, but for the sake of our viewer.
So there are lots of studies out talking about vitamin C and anti-malaria. So for me, what we practice, which is also, if you look at the guideline, there's no place for you to be giving vitamin C alongside with anti-malaria. But the studies have shown that there can be some form of interaction between these two. And like I said earlier, when I talked about, we need to go back to when medications are produced. One thing I've come to see is that most times we never read the leaflet that comes with this medication. What is the company saying about the drugs? There's what is called drug-drug interaction, and it's very important. So if there is a drug-drug interaction, the companies are going to list it there. And then if we look at that formula, that guideline from the company, that will help us. So with that research that has been done, it's not really advisable to say we're doing malaria with vitamin C. And then I try to also find out from my own self, why do I also want to be doing vitamin C alongside with anti-malaria? There's really no basis for it. What we advise is that you can give the anti-malaria alongside with paracetamol, because the person is either having some form of weakness or is having headache or is having fever. That will help. But what's the role of the vitamin C alongside the anti-malaria? It's not really very clear. And those studies have actually shown that there are some form of interactions that may not make it be very effective. Yeah, thank you.
Okay, thank you very much, Ma. Then, okay, there's another question here. Okay, it's related to the
The
NAFDAC ban on the
suspension.
NAFDAC ban on the suspension. Says if that there is a recent rumor that malaria medication in powder form becomes ineffective after it is mixed. How true is it? I know this is typical to the artemether lumefantrine suspensions. Okay, Ma.
Oh, sorry, I got muted. So I think we actually addressed this at the beginning. So there are lots of issues with suspension, especially if you also look at our climate. We're in a tropical environment. And then how are these suspensions mixed? I remember each time I want to prescribe suspension for mothers, I'm never in a hurry, even for the antibiotics. I'll carry that container of the antibiotic and I'll show you the mark that the water level should be here. And then when you finish, make sure you mix it properly. Each time you want to give the drug, mix it properly. Remember, we call them suspension. That's suspension. So if you now, like a mom leaves it at home and then goes out and tells her girl, give my daughter the drug or my son the drug, that little girl is also a child, your nanny, except you're having a nanny that is grown. And even the nanny that is grown, how educated is that nanny? You know? And if you did not remember, tell them, shake the bottle. They just give the top of it. So there's nothing, it's not going to be effective. So I think what NAFDAC has done here, let's applaud NAFDAC because they've gone out, they've seen it, and they've done a lot of asked questions, research that's shown that it's not that the company is the one failing, but many times it is now we, the environment, so many factors that have come into play. And then ability to preserve this suspension in the right temperature so that it still maintains the potency of the active drugs. So with all that, that is why NAFDAC is saying, can we move to something that is just a one-off thing, like I just drop the tablets and then I get a result and I move. That is why NAFDAC has come up with that. But 100%, it doesn't mean that if you have suspension and you are doing it correctly, maintaining all that is said, that it's not going to work. But it's just looking at the general population. Just like you just talked about a mom saying the child had febrile convulsion and in the school, nobody knew what to do. So this is what NAFDAC is looking at the entire community. How can we ensure that at least up to 70-80% of the community get whatever we are doing right?
So Josh, so when we get ready for our giveaway, I would like us to type in the comment section the lesson that came home to us. What's that one thing that you are leaving this live webinar with? What is something new you've learned and you're going to start practicing after now? We are waiting so that we are sure that we've not just been speaking English since 5 o'clock. Okay, have some medication and thank you. Not just all medications, but paracetamol in case your child comes down with high fever. Okay, another person says malaria injections are for severe malaria. Okay, remember the timing for optimal dosage. Thank you, Jonathan. Okay, Dolami says, I learned that tests should be conducted before thinking it's all malaria and that not all fever is malaria. Very good. Thank you very much. This is very important. Not all fever is malaria. So do well to do a test before treating malaria. Any other person? Okay, Amelita says she learned that boosting a child's immune system is very important and having emergency medications and knowing when and how to administer them is important. Always test before you treat malaria. There is no laid down frequency. Thank you very much. Ranch and Buy Food says that schools are to have at least paracetamol in their sick bay. Get tested before treatment. Thank you, OTB. Naya, are you ready for the trivia?
Yeah, thank you so much, Damilola. Thank you so much, Dr. Joanna, as well. It's really been an interesting session. I myself have learned a couple of things, very important too, as well. And I like that people on the call have also learned one or two things which they've shared in the comment section. Unfortunately, my own comments is frozen, so I can't see a lot of the comments coming up, but Damilola will help me. So thank you so much, Dr. Joanna. I know you went
Thank,
out of your way to do this for us. We
eh?
really appreciate you.
Thank
And yes, we thank you so much. So, courtesy of Emzor decided to do a mini giveaway for people that joined the live session today. Giving out five participants on the call today, 3,000 naira worth to five participants on the live session today. So, we'll just ask five questions, and the fastest and the person who types the answer first would be the one that would win. So we'll make it a mix of what we've learned from the call today and then just general questions. So that we will not say that we're asking hard questions or or some people will accuse us that they came for a lecture and we want to and we're questioning them so much. So we'll just make it a mix of all kinds of questions. So, Damilola, please, you'd help me to note the people that answer the questions first, correct answers, because I can't really see comments popping up on my end. And
Okay.
I'll just start with it. Thank you so much. So let me just quickly start with. I'll start with the question from what we have learned today. So let's see. So the first question is the most dispersible formulations, they are approved for use in children starting from what minimum age? So the dispersible formulations that we've discussed today, from what minimum weight rather is it approved for use in children? A, any weight or from birth. B, 10 kg. C, 5 kg. D, 15 kg. So I'll take that again. Most dispersible formulations are approved for use in children starting from what minimum weight? A, any weight or from birth. B, 10 kg. C, 5 kg. And D, 15 kg. That is not too hard. Do we have any answers or responses so far? Or any winner?
Okay, same one. Harrison Ali cases C 5 kg.
So yes, the answer is 5 kg. C. Well done. I'm sure some people were like, this question is like my ex question or something. Okay, so I'll just ask a simple one now. I mean, let me mix it so it's not so difficult. So, who was Nigeria's first female finance minister? Who was Nigeria's first female finance? A. Ngozi Okonjo-Iweala. B. Kemi Adeosun. C. Dora Akunyili. And D. Desiani Alison Madueke. This one is not hard though, so you will not accuse me now that I'm asking only hard questions. Who was Nigeria's first female finance minister? I don't even need to call out the options, so do we have answers, responses? So do we have any response? Do we have any winner? This one we should have like 200 responses in 1 minute.
What's the answer? Because I can see quite a number of options
So the
here.
answer is Ngozi Okonjo-Iweala.
Option A.
Yes.
Okay, we have a winner. You can see Jonathan Riosa.
Okay. All right. Congrats for winning our airtime. So I'd also ask the third question. Let me not add one that's so difficult. If a child vomits within 30 minutes of taking anti-malarial medication, you should A, wait until the next scheduled dose. B, give half of the dose again. C, repeat the full dose. D, switch to a different medication. So if a child vomits within 30 minutes of taking anti-malarial medication, you should A, wait until the next scheduled dose. B, give half of the dose again. C, repeat the full dose. D, switch to a different medication. And the answer is, do we have responses?
Yes, we have responses.
Okay, so the answer is repeat the full dose. So like Dr. Joanne had mentioned, if the child vomits within 30 minutes, repeat the full dose. But if it's over an hour, please do not repeat the dose again. And if it's more than twice within 30 minutes and the child has vomited, please visit the hospital so that they can either switch to an injectable. So what's our correct answer? Or who is our winner?
So what's the correct option? What's
Yeah,
the
hi,
Repeat.
correct
Nani.
option?
I didn't hear you.
What's the correct option? I didn't get the correct option.
Option is repeat the full dose. Repeat the full
Option
dose.
option C.
Option C, yes, option C.
Okay. We have a winner. Ale Bonny.
Hey, hi, welcome. Congrats, 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 congrats. I Larry, congrats. All right, so that's the one from the community. And then, so we have the question 4. Let me ask one simple one now. Question 4. Let me ask a simple one. Which Nigerian musician won a Grammy Award in 2021? Which Nigerian musician won a Grammy Award in 2021? A. Burna Boy. B. Wizkid. C. Davido. D. Tiwa Savage. This was not hard to. Which Nigerian musician won a Grammy Award in 2021? A. Burna Boy. B. Wizkid. C. Davido. And D. Tiwa Savage. Can I say the answer?
Yes,
So
yes, you can see the answer.
Okay, so the answer is Burna Boy. A.
Okay, we
I'm
have
sure
a
we have like,
winner.
okay.
Henrietta Bright.
Yay! Congrats, Henrietta. All right, so let me ask the last question. The last question is, okay, yeah. So recurrence of convulsion is less likely to happen to a child who has had convulsion before. Yes or no? Recurrence of convulsion is less likely to happen to a child who has had convulsion before. Yes or no? What's the answer? What's our response like? People paying attention. Can I say the answer?
Not yet.
What's going on? Hey, God. Somebody has answered that question till now. Hey, God, this is long for my hand, though.
Okay, you can say the answer.
All right, so the answer is no.
Okay. Okay, so we have the winner.
Okay.
We have the winner.
Okay, so based on what Dr. Jan has said, she said that if a child has had convulsion before, the likelihood of that child having a convulsion again is high. And doesn't still mean that it cannot happen in a child that hasn't had convulsion before. No, but we're just saying that a child that's had it before is likely going to happen again. Yeah. So, and even based on what she even said, I think an experience I know I've also had with a mom too. She had mentioned that her child had had convulsion once and also had it again twice. I think about 3 times or so. Yeah. Yeah. So something I recall. So let's ensure we also always monitor high fevers. We ensure we have a thermometer at home. Ensure that when the fever is high, we use tepid warm water. Please, moms, let's not go and put the child in the bath and throw cold water on the child. No. We'll just put that child in shock. The child's brain will be like, what's going on? I'm very hot and cold at the same time. It's just, the child's brain will be all over the place, please. So tepid warm water and we sponge the child, not pouring water on the child. And while we do this, we rush the child to the hospital. So thank you all so much. It's been a really interesting session. I have learned a lot. Thank you so much, Dr. Joanne. It's been so interesting with you on this live call.
I've enjoyed every bit of it. Thank you so much,
Thank you.
Thank you so much, Ma, for honoring our
team.
invitation. Thank you so much.
Yes.
Thank you. And thank you to all our moms on the call, because without them, we wouldn't have been here talking to ourselves. Thank you.
Thank you all for joining. So before we leave, I'd like to remind us of a few things that we've learned. Important things. Do well to test before treating malaria. Not every fever or generalized body weakness, especially in children under 5, is malaria. Have a thermometer at home. Have paracetamol, Emzor paracetamol dispersible at home as well. Keep all medicines out of reach of children. Speak to your pharmacist when you're in doubt about medicines. When you want to mix your dispersible tablets, make sure you use clean water, clean containers, so that your child does not come down with diarrhea while you're treating malaria. do well to ask for local dispersible tablets when you go to the pharmacy to buy anti-malarials for your children. And for moms that are looking for communities, you can reach out to the Mom Circle. Buy quality, buy Emzor. Emzor is not just a paracetamol company anymore. We are doing a lot right now in the import substitution space. Quality medications, think Emzor. Thank you all so much for joining. See you in our next
Thank you
live
all so much.
webinar.
Thank you all so much and have a fantastic evening. Thank you, Dami and Steve. It was an amazing
Thank
session.
you. Thank you.
You're
Bye,
welcome.
everyone.
Thank
To
you,
everyone
Dr.
who joined,
John.
we
Thank you
made it a
so
very
much. Bye
interactive
bye.
section.
Thank you. Bye.
Thanks. Bye, everyone. So we'll be reaching out to the winners and then we'll give them what their activities is. Thank
Thank
you
you.
all.
Bye.
Definitely. Bye.
Bye.
Bye. Bye.